Alrighty, good afternoon, everyone. Welcome to the verbal sessions. My name is Ryan Kronk. I'm with the Water Institute. It's great to see all of you here in person and everyone online. Welcome. This afternoon session is on rural WaSH. And up first we have Kate Albi and Emerald Dudzinski from Virginia Tech. Take it away.
Okay, cool. So, hi everyone, I am Kate, and this is Emma, and today we're going to be talking about the implications of bottled water reliance in rural West Virginia. So just before we get started, a little bit about us. I'm Kate. I'm currently a master's student under Dr. Leanne Cremitas there at Virginia Tech in the Department of Biological Systems Engineering.
And I'm Emma. I'm a PhD student in Industrial and Systems Engineering.
All right. So, as I'm sure many of you all know, despite universal perceptions of universally available, safe drinking water, issues related to drinking water safety still persist in the United States. Today, almost 500,000 Americans lack complete plumbing. And when we talk about complete plumbing, we say lack of access to hot and cold running water, a sink with a faucet, as well as a flushable toilet. Additionally, over 1,000 community water systems did not meet at least one EPA health or safety standards. And in total, over 21 million Americans rely on public drinking water systems with at least one Safe Drinking Water Act violation. And I think it's important to note that that statistic only includes public systems and does not include any private water systems such as private wells and possible violations that they might have as well. Most importantly, this burden of unsafe and inaccess to drinking water in the U.S. is not distributed across the population equally. Violations have been shown to be spatially clustered in rural communities, as well as in lower socioeconomic statuses, and minority populations are more likely to experience repeat violations. So the question then becomes, what if you do not have access to or trust in your in-home drinking water? A lot of times the answer to that question is bottled water. And in America, we have seen the continued rise of bottled water. This is a graph of data from the International Bottled Water Association's annual report on bottled water use, reliance, and perceptions throughout the U.S. And we've seen an incredible increase in the per capita consumption of bottled water across just the last 20 years. And this is in America alone, does not include any global estimations. So we've seen in 2001, just less than 20 gallons of bottled water consumed per capita, and the International Bottled Water Association estimates that that number will climb to almost 50 gallons in the next couple of years. So our research goals for this project were to quantify the traditional markers of water quality, so things like we all know, fecal indicator bacteria, metals, nutrients, etc., as well as our really fun emerging contaminants of PFAS and microplastics in both in-home samples as well as bottled water. We then wanted to compare those in-home water samples and bottled water samples to the Safe Drinking Water Act to identify common water quality constituents of concern. And we also wanted to characterize typical water concerns and usage patterns throughout these communities using a survey. We asked homeowners. As well as Emma will talk about later, we wanted to assess water affordability by creating models of both direct expenses and indirect expenses related to different supplemental water source uses, including bottled water. So for this study, we partnered with Dig Deep in McDowell County. And what's most notable about McDowell County is that their 2021 median household income was estimated to be about $30,000. I believe the most recent estimate is that they are now the third poorest county in the United States, with almost 1/3 of residents living below the poverty line. Previous studies also in this county have garnered national attention, not for great reasons. Leanne has done a lot of work there previously as well. Dig Deep has also noted that bottled water is now the most requested item at the local food bank in McDowell County. And previous work has also identified bottled water reliance to be especially high in various Appalachian communities. So our data collection for this project, we used 15 household surveys with 14 corresponding in-home samples. Like I said, 14 in-home samples, and additionally 4 roadside spring samples that were previously identified from our surveys, as well as 6 brands of bottled water. We chose specific brands that people mentioned in these surveys, purchased from grocers, also specifically mentioned from our surveys. And we tested them for pH, conductivity, metals, inorganic ions, fecal indicator bacteria, and then, like I said, PFAS and microplastics. And the survey that we used for this data was adapted from the UN Multidimensional Poverty Assessment that Dr. Cohen in the back worked on.
Okay, so I'll overview some of our survey demographics. Like Kate mentioned, we surveyed 15 households, and about 50% of them reported an annual income of less than $15,000. And 80% were below the national poverty line for a family of 4. Further, 80% of them reported an education level of high school or lower, and all but one survey respondent identified as white alone. Then we looked at their water use data. So 73% of them view non-bottled water quality to be satisfactory or less, and they cited unpleasant taste, odor, staining laundry or appliances, and proximity to traffic for things like roadside springs. Then we found really surprising, only one of our respondents relies on their municipal water supply, the in-home piped water, as their primary drinking source, or actually primary or secondary drinking source. And then the other 14 rely on bottled water as either a primary or secondary drinking water source. And those reasons include convenience, lack of access if they're not on the municipal supply, or perceptions of unsafe tap water if they do have the municipal supply.
So going off of the water use data, we then wanted to know what was in the water. So overall, the water quality that we tested was extremely poor. And I think it's important to note the sources that our in-home samples came from. So we had 5 municipally sourced water samples, 4 private well samples, as well as 5 surface water / spring samples. So a lot of people that were using surface water as a drinking water source were actually hauling water from that spring or surface water connection and then piping that into their homes. Almost 80% of our samples were coliform positive, as well as 36% were E. coli positive, both of these indicative of fecal contamination. Almost 30% exceeded the EPA iron aesthetic guideline, which is usually correlated with a brown appearance and metallic taste, going into different, again, perceptions of unsafe water. Almost 50% of our samples as well exceeded the sodium health guideline. And what was particularly notable about our sodium statistic is that a lot of these violations were found in municipal samples, which was really interesting. Additionally, our sodium guideline is for people that might not consider sodium from their drinking water to be a particular portion of their diet and daily sodium intake. So for different people with different health issues, this can be extremely problematic. So moving on to our emerging contaminants, we found that 86% of samples contained detectable PFAS compounds. And when I say detectable PFAS compounds, we test for, I believe, 30 different PFAS compounds. So 86% had at least one detectable PFAS compound. So the average across all of our samples was a total of 1.13 parts per trillion of total PFAS, so the total of all those 30 species. And only one sample exceeded the PFOS proposed MCL for 4 parts per trillion. Additionally, 100% of our in-home water samples contain detectable concentrations of microplastics with an average concentration of 4.3 particles per liter. We also looked at the specific polymer that was present in our microplastic samples, and we found that 25% of samples contained thermalite, which is an insulator, as well as polyamide and copolyamide. Those are actually clothing polymers. Polyvinyl acetate is a glue, and polyvinyl chloride is actually PVC, so directly related to the plumbing of these homes. Overall, our bottled water quality data was much better than that of our in-home water quality data. Bottled water samples exceeded no EPA MCLs, SMCLs, or health reference levels. Contrary to a lot of the literature out there, we actually saw no detectable PFAS compounds in any of our bottled water samples, as well as 100% of these, however, did contain detectable microplastic concentrations with an average concentration of about 6.7 particles per liter. And the polymers we found in our bottled water samples were polyethylene, high density and low density, presumably from the bottles and caps themselves.
Yeah, so then we were also curious about what their affordability levels were, especially since we're looking at a really low income county. So we decided to measure affordability as their water-related expenditures as a share of household income. And then we compared that affordability to some main affordability standards that range from 2 to 5%. And we also found, as we were doing some surveys of previous literature, that there is a huge need for a comprehensive analysis that considers the full economic burden. So that includes financial costs that are directly out of pocket, things like buying the bottled water in stores, paying your utility bill, or paying someone to haul water for you. And then also in looking at non-financial water-related expenditures. So if you're going to a roadside spring, the gas to get there, the productivity loss due to time spent collecting. Same with bottled water, you're going to the store a lot more, so we're looking at those sorts of indirect cost. So this graph kind of shows a little bit of that. I have the households ranked from lowest income to highest income, and it shows the direct versus indirect water-related expenditures. And then that blue dotted line is the 2% EPA affordability standard. So we can see every household greatly surpasses this. The two lowest households rely on wells a lot, and we were not quantifying anything with well-related expenses. I also think it's quite interesting that the lower income half are relying a lot, or their expenditure has a lot more indirect cost. So it seems like they're trying to avoid that direct out-of-pocket money, but they're still carrying a large burden. And it does come back to a financial burden at the end of the day. So if we look at the bottled water expenditures specifically, we can see in the dark blue, that's the purchase, and then the two lighter blues are the gas to the store and the productivity loss, because some people are going to the store every single day to buy bottled water, so much more than you would go for your groceries, and the stores are pretty far away from people in this county. So it's very interesting that, as Kate mentioned, bottled water quality is really, really good actually, but it's so financially burdensome. So for people who rely primarily on bottled water, they're spending 8% of their household income annually on purchase of bottled water alone, and they have many other expenses as well.
Yes. And just to sum everything up, we found that bottled water use in Reliance is extremely high in McDowell County, and that's presumably due to the poor in-home water quality we found in a lot of our samples. Comparatively, bottled water was found to be a safe drinking water source with no EPA, MCLs, SMCLs, or health reference level violations. However, reliance on bottled water is associated with an extremely high financial burden. And we actually will be doing parallel community work and water testing in Harlan and Letcher County, Kentucky, I believe in about 2 weeks here in November of 2023 in partnership with Headwaters. So that's really exciting. Oh, and then, whoa. Any questions?
Yeah?
Oh,
Oh, there's a mic.
sorry.
So did the participants before doing this know previously that they had poor water quality, or was it their perception that they had poor water quality, and then you kind of confirmed that?
So it depends on the home. We partnered with Dig Deep, so in doing so, people that had previously mentioned that they believed their water quality to be poor, or even if that was proven, we were given their contact from Dig Deep and then did it again. But a lot of times people in McDowell County and communities like it don't have those resources or availability to get such a comprehensive test at a free cost.
Yeah, great presentation. I was curious what your take is on the health effects of microplastics, because you said 100% were in both bottled and the municipal water, so I'm just curious what your takes are on that.
So that is a great question. I just want to clarify that it was present in municipal supplies, as well as private well supplies, and surface water supplies, and bottled water supplies. So a lot of the literature also suggests that microplastic contamination is pretty ubiquitous in the environment, and now a lot of anthropogenic pathways as well. The problem with that, however, is that we don't really know what is a safe level of microplastics, and that's what makes it an emerging contaminant of concern. Additionally, we don't really know a lot of the health effects yet either. Microplastics have been found in the human bloodstream as well, but contrary to PFAS, where we know a little bit more about those health effects and how those chemicals impact, say, the endocrine system, we really don't know much about microplastics other than just that, like the physical ingestion, really. Yes?
8% is a lot, and that surprises me. Do you know if these households were using the water for both drinking and cooking, or?
So that depends on the house.
Yeah, yeah.
Some houses used bottled water for both. Some houses used their in-home piped water for cooking or cleaning or bathing, and then just bottled water to drink. It really depended on the house. Yes.
Yeah, going back to that, like for affluent water, we have terminology like gray water and black water that makes it easier for people to understand. I mean, even for educated people, it's really difficult to comprehend all the different things that go into water quality. We just take it for granted, right? Like where I come from, we just drink tap water and things like that. But is there such terminology for the water coming into your house that the government can use? Like, it's obviously better than gray water because you can probably use it for bathing. I assume there's not something in drinking. So is there such terminology that they can use so that people understand what they can do with the water they get in?
So if you are on a municipally supplied water source, you do receive an annual water quality report from the EPA that says if your municipal has any drinking water violations. However, a lot of people that are on federally unregulated sources, they don't have that, and maintenance is up to the homeowner themselves. So there is no specific terminology about if their water is good, if their water is bad. But the people that did participate in this study, their results were sent back to them in a comprehensive manner that made it easy for them to understand and possible solutions as well.
Does that report make it clear what you can and can't do with the water? Or what uses you can?
Yes, or like if it is not recommended to drink per se. Yes.
Assuming that the municipal water is more or less equivalent across households, was there any effort to do a control study in homes to sort of perceive their water quality to be better, but maybe confronting these same problems, and see whether there was any differentiating factor in the same field? And I think that's a very good point prior person made about how we talk about source stacking, how we generate something from time to beyond in terms of something you see a lot of other countries that using rainwater surface water sources, a limited amount of treated water for different uses within the home. We don't have to do anything worse about that.
Yeah, we have not done a control study for this one yet, but that is definitely a good idea for the
But
future.
also I'll note, only one household thought their municipal supply was good quality. Everyone else did not trust it. Thank you.
Let's give our presenters a hand. Sorry, we need to move on, but there is time after. If you'd like to catch the presenters, I think they can probably hang around for a few minutes, so please catch them. I also forgot to mention, if you can try to come up and use the mic so our online audience can hear your questions, and if presenters, if someone doesn't do that, if you could try to repeat it briefly for the online audience. All right, up next we have Florence Udenby from the University of Toronto.
Do you know how I switch it? It is. It's open. Thank you. Good afternoon. Thank you for joining me. My name is Florence Udenby, and I'm with the University of Toronto in Dr. Meyer's Water and Health Lab. And today I want to share with you what I've learned about some rural piped water systems in part of Gujarat, and more particularly what users think of their experience with their piped water systems. So you're probably aware that there's this increased focus on providing on-premise water supplies, which usually results in piped water supplies. And a really strong example of that is the Jal Jeevan mission in India, which aims to provide every rural household with a functional tap by 2024. And the design guidelines include that everyone should receive 55 liters per person per day. And the reasons for piped water systems have been well outlined in the literature. We know that some benefits include that water becomes more available, accessible, and safe. And when that occurs, we can save time for women and girls and reduce the risk of diarrhea. But a big caveat is that these benefits are true when the piped water systems operate continuously, 24/7. But a big challenge is that a lot of piped water systems operate only intermittently, so less than 24 hours per day. And when that happens, we see that there's actually limited volumes of supply being distributed, and this water has degraded water quality and is distributed unfairly throughout the piped networks. But a lot of the studies conducted on intermittent systems, including the ones that I've cited here, have focused on urban contexts, with few research being done on rural systems. So with that in mind, my research has thought about intermittent systems, specifically rural piped water systems, and how do rural communities interact and experience their piped water systems, and how might this differ from non-piped. So in September of 2022, I went to Gujarat, which is a western state of India, and I went in September of 2022, and it's just important to note that this was the end of monsoon season, and this area experiences 3 distinct seasons. So monsoon is hot and rainy, winter is cool and dry, and then summer is hot and dry. I visited 6 communities and spoke with 106 participants, mostly women with whom I conducted interviews and focus group discussions. And the women were the focus because they are primarily responsible for water collection in these communities. But I did also conduct focus group discussions with just men in each community. So across the communities, they were relatively small, with just 28 to 36 households each. And the number of functional household tap connections ranged from 0 to 90%. So no community had 100% functional taps, but the communities that did have piped water systems had near 100. And these pipe systems actually predate the Jal Jeevan mission, and so their experiences with piped water is not new. But the communities without piped water systems will be receiving piped water soon, so this was an opportunity to speak with them before they receive their piped water. The power source in these communities for the water systems were solar panels or grid. And there is 4 primary types of water supply between all the households. So piped water supply, which in this case means a bore well, which discharges directly to an elevated tank, which then flows by gravity to the taps. Hand pumps, private bore wells, and in this case, the individual households owned the bore well, and they may share it with some of their neighbors. And then there's also open wells, which had submersible pumps, or residents used buckets to pull water out. So with all the interviews and focus groups, I did a qualitative data analysis, including coding the data, and from this, I found 5 major themes, with them including improved access over the long term, preference for tap water, reduced household autonomy with piped water systems, some seasonal issues, and electrical issues. So I'm going to go into more detail with all 5 themes. So the first theme is good news. All residents across all communities felt that water access and availability has improved over the long term. So one woman described how this situation used to be very bad, but it's better now and she's happy. Another woman described how much time she had to spend a whole day collecting water, but now it's more about half an hour. So that's good news. We also found that across the communities, tap water is the preference. So every participant was asked what their preferred water supply was. So in this chart I'm going to show you, we have what they currently have, what their preferences were, and we found that the majority of people, or almost a lot of people, preferred tap water. However, a majority of the borewell users actually preferred to have their borewell over any other source. And when we followed up with why the tap water was their preference, they discussed the convenience and how it feels effortless. Borewell users discussed how easy it was as well, with this example of it's just about turning on a switch, no labor like hand pumps. And this leads me to my third theme, which I'm calling the rigidity of a piped water system, and how this reduces household autonomy. So in piped water supplies, we found that there is unreliable supply time. So in this person's perspective, they say the person who starts the water, they just come and tell us it has started. No other warning. Whereas in this community, they described how when the water is about to come, it makes noise, but if you're not there at that time, then you miss the water. However, in communities with borewells and hand pumps, they discuss how much more choice they have in the matter. So we can go 2 to 3 times per day. Whenever we need water, we go fetch it. If we require more water, we can ask them to switch on the borewell and get more. So just to summarize this, with piped water supply, we found some unreliable supply times as well as a really limited supply duration. But with borewell and hand pumps, users had a lot more choice. I mentioned seasonal issues, so specifically, summer is hot and dry, and 93% of the participants identified issues, and that's that in summer, the water demand is higher, and this coincides with a lack of supply in summer. So hand pumps like these do not function all the time in summer. This is similar to other findings in the literature that discuss how lack of rainfall results in an increased reliance on community supply systems, and also across India, summer water scarcity is relatively prevalent. One woman discussed how in summer we face problems and I have to be careful when using water, and also the extra labor involved, so they have to pump hard to get enough drinking water and water for household purposes. And also they need to think about storing more water, and then there's this additional concern of what if the electricity gets cut off, which takes me to my fifth and final theme, that electrical failures stress the water supplies as well. So when there's an electrical shortage, there's a water shortage. So the grid supply issues is that there's regular cutoffs of the electricity throughout the year. So when I was there every Tuesday, there is no power. And monsoons can cause longer outages. And this has also been well documented in the literature that unreliable electrical supply also causes water supply issues. Some of the communities tried to mitigate this grid supply issue by installing solar-powered pumps. However, they also found that weather affects the functionality of the pump. And really previous literature that I've seen has focused more on just how there might be capacity issues in the morning, but not so much season or weather affected issues. So one woman described that the electricity went off during heavy rain and they didn't get water for 3 days. And that when there is no electricity, then they try the hand pump or some other alternative source. And with solar pumps, if it's a sunny day, we get water for longer hours, but if it's cloudy, we get less water. So both the water scarcity issues from summer as well as the electrical failures mean that residents have to come up with coping strategies to mitigate these problems. So a primary coping strategy is to rely on hand pumps, but these are not always available, particularly in the piped water systems. The hand pumps don't function or haven't been maintained. So instead, they have to rely on unimproved water sources, or they may have to store more water or use less water. And these coping mechanisms, you're probably aware, result in a higher risk to infection. So in conclusion, we know that there is this preference for piped supplies, and that piped supplies are only going to increase not just in India, but across the global south. But we have to keep in mind the issues or challenges with piped water supplies. So as we saw, there's unpredictability and limited supplies, and they're still vulnerable to electrical supply shortages, and residents still have to rely on unsafe coping strategies. So my recommendations is that, as we saw with the unreliable supply times, we need to think about designing piped water supplies that provide more operational flexibility and more choice for the users. And we need to provide more robust electrical supply mechanisms so that we better support these piped water systems being installed. And to work with communities to mitigate seasonal supply shortages and help them incorporate safe coping strategies. These are my references, and I'd like to thank my partners for their help with this work. Thank you. Any questions? If you could please stand at the mic.
So I'm curious, are all of these, I love that you got all the different sources. Any differences in water quality across sources, or is it's all of the decision-making is based on kind of convenience?
All the decision there was based on convenience. I did not collect any water quality samples. I did hear about a preference for groundwater over surface water, just with their beliefs on safety, but I didn't collect samples. Please.
Thanks for the presentation. And with the type of community-based study that you're doing, I mean, one aspect of it that's interesting is, you know, in what kind of geographic context, say Gujarat has enormous diversity. I would be curious what district you're working in, that kind of thing, because they have such different problems. But related to that is the question of how your data will kind of gear up and connect or help correct some of the national data sets, like the IMIS database and the contour functionality assessments. Any insights on that front?
Great questions. Yes, the district or the communities I went to were actually all scheduled tribe communities. So within the 6 themselves, of course, there's differences, but there's not too much heterogeneity. My future work will actually be looking at quantitative data, so looking at how much liters per day households are actually getting, and that there's no immediate plans for like correcting the data that currently exists out there, but hopefully our study could inform more studies or other data collecting methods.
Yeah, thanks for the presentation. Did you look at rainwater collection during the monsoon? I mean, that seems like a way to get drinking water.
Yeah, that was discussed in the interviews, but actually of the interviews I did, only one household did rainwater collection. It was surprising to us, actually, that rainwater collection was not a major source stacking. What? Just not that I could speak to you right now.
Thanks. To the point of your future research, perhaps, are these connections to pipe systems metered, and are users paying anything for the water that they're using?
The users are currently paying in the piped water for some of the systems. Like one piped water system, there's kind of like a water tariff that everyone pays. One pipe system, the less reliable piped water system, they do not pay. And then the non-piped systems, they share the costs in fixing or doing maintenance as needed, but there's no official structure. And sorry, it's not metered yet. Well, there is a master meter in a couple of the communities in this area, but our plans for quantitating the water distribution is to use meters at all the household taps.
Fantastic. Thank you.
Any final questions? All right.
Thank you.
See if Florence had any. Is that your flash drive?
No, I can get it though.
Okay. Let's just see if it's on
Oh,
this.
it's under water presentations.
Okay, perfect.
Oh,
No.
maybe if you go back a folder. Monday. Oh, weird. I'll get my flash.
Okay. I think is this yours? Is this it?
Yeah,
Okay, great.
thank you. Couldn't find my flash drive. I think this was-
All right, and our final presenter today is Marla Wehrli from the Alaska Native Tribal Health Consortium. Take
Yes,
it away.
it's a mouthful. Hi, everyone. My name is Marla Wehrli. I'm a research associate from the Alaska Native Tribal Health Consortium, and today I'm presenting on the impact of the mini-pass system on water security, sanitation, and health in unpiped rural Alaskan homes. So land acknowledgements are very widely practiced in Alaska, so I will begin by saying I live and work on the ancestral lands of the Eklutna Dena'ina. I am grateful for the Dena'ina's past and present stewardship of the waters, plants, animals, and spiritual practices of this place. I moved to Alaska 3.5 years ago, and I have a lot to learn still, but I do strive to consider Alaska Native culture and history and traditions when doing research and doing the work that I do. I'm going to talk about the mini portable alternative sanitation system. That's the only time I'll say it in its full form. We call it the mini pass system. Our research methods, which is how we evaluated the impact of the system on households. Some of the findings regarding health, use, and quality of life, and then some of our next steps. So this photo shows an example of one of the many remote communities in Alaska. This one's at the junction of two rivers. Some background info about water security in Alaska. In the 1960s, Alaska Native people were forced to permanently settle in remote communities. And this remoteness, so the far distance from the road system, as well as an environment that requires special building materials, makes infrastructure difficult to build and maintain. For example, in the interior, summer highs can reach above 90 and lows below -50. So infrastructure in these areas is expensive, and there is a lack of funding. Therefore, there are many people without piped water, leading to water WaSH disease. These water security concerns are exacerbated by climate change, which takes a heavy toll on rural Alaskan communities. So people without piped water and sanitation services have adapted to these circumstances by using wash basins for hygiene and honey buckets for human waste. So this is a picture of a wash basin in one of the homes that later had a mini pass system installed. And on the right is a honey bucket in a kind of like a workspace closet. Sewage is self-hauled out of the house, likely exposing people to fecal-borne pathogens. This sewage ends up in sewage lagoons, which are open pits filled with sewage and plastic bags of sewage and other garbage. And these lagoons are prone to failing. So, and that means that they can spill into areas that people are dependent on for subsistence activities and collecting water. Water is self-hauled to the home, usually from washaterias, rivers, lakes, and rain. The left side shows someone filling up water at a washateria in the community. So that's just a facility that offers treated water when it's open and available. On the right are photos of buckets outside of the home, someone collecting rainwater. Everyone has their own personal methods of how they like to haul water. In the winter, many people chip ice from frozen lakes or rivers and haul it back to their home and wait for it to melt. But all of these methods are time-consuming, laborious, and usually require a vehicle. Once home water is stored in the main living area in big containers like garbage cans, things like that, and then dipped out for use. So remote Alaskan unplumbed homes use an average of 1 to 3 gallons per capita per day. I think you guys probably know better than me, but the average US consumption is somewhere over 100. So this is a very low quantity of water. Water reuse and rationing is really common. And these practices lead to higher incidence of water wash diseases, especially respiratory, gastrointestinal, and skin infections. And early in the pandemic, data showed a higher instance of COVID-19 in households without in-home plumbing. So this is the mini pass system in response to COVID-19. The organization I work for, ANTHC, received funding from the CDC Foundation to develop the mini pass system to quickly address hygiene needs in order to prevent SARS-CoV-2 infection in unpiped Alaska Native communities. So it's a targeted intervention to promote hand washing. The system includes 2 components, a hand washing station, so that includes a gravity-fed sink, so people can wash their hands in clean, free-flowing water compared to the wash basin that I showed earlier. And it includes a pump at the bottom for filling the tank, and then at the very top is the water tank that holds 20 gallons of water. And the bottom has a 5-gallon bucket to collect gray water, as well as an alarm that rings when the bucket is full to know that someone has to go out and dump that bucket. The water is purified, but not to drinking water standards. It's definitely a hand washing station is what it's meant to be. On the right side is the vented honey bucket, and it is a non-flushing toilet. It is still a bucket that people have to dump, but it works to pull odors out of the home, which actually ends up making a pretty big impact to people's quality of life. So as you can see, about 350 of each, a little more of the hand washing stations were installed. People got to choose if they wanted one or both installed in their home. These were installed in 14 communities. So our team came in to do an impact assessment of the system. We conducted semi-structured interviews with 147 separate households, and these were people who identified as being knowledgeable about water and health in their home. Over 60% were women. So we had one baseline interview and 4 post-installation interviews from the 2021 to 2023. And this was a mixed methods approach using both qualitative and quantitative methods. I definitely focus more on the qualitative side. Yes, it's made a difference. We don't get sick as often. My daughter doesn't get sick as often. Usually we get hit with influenza, but I think the hand washing station has really helped. I'm beyond thankful for not getting influenza this year. So this is a quote from a mother and former community health aide in her community in her 30s. Our findings our health-related findings show that households with children 12 years old and younger that reported using the hand washing station as their primary hand washing method were significantly less likely to have respiratory symptoms. Households that reported using it as their primary method also reported hauling significantly more amounts of water than households that reported using wash basins only or both wash basins and the hand washing station. And people with the mini pass unit appear to increase usage of water over time. So are people using the hand washing station and the vented honey bucket? Before installation, all households used wash basins for hand washing. Post-installation, when we looked at the summer of 2022, 78% of households were using the hand washing station for hand hygiene. Similarly, the people before mini pass, people were using honey buckets or outhouses. and 89% were using the vented honey bucket as their primary toilet in the 2023 data collection. You can see the image on the right, 2 children using the hand washing stations. A lot of households express that their children really enjoy using the hand washing station. It's fun. Actually, a lot, like also mentioned, they like use too much water or leave it on or different things, but good to know that they find it fun to wash their hands this way, and that's making an impact on their health. So overall, people were very satisfied with the system. 99% reported a positive response to the hand washing station, describing it as easy and convenient to use. So domestic and personal hygiene practices were easier. People saved time hauling water, refilling water. Water was more accessible in their home. It felt more sanitary to wash their hands this way, and it positively impacted their safety. Regarding the vented honey bucket, 96% reported a positive response. One interviewee told us that the vented honey bucket is a big help. The smell doesn't come all throughout the house, and it vents out of the house. It makes it feel like we have water and sewer. I love the vented honey bucket. That way we don't smell like honey buckets when we come in. It's a big help. And as you can see, her experience is shared by others who mentioned increased comfort. The biggest thing people said was there's less odor in the home. That was the biggest takeaway. Also, more comfortable seat. It's easier to clean, maintain, carry, and dump, especially for elders or those with mobility concerns, mobility challenges, that it's safer than their previous toilet. So people are more likely to avoid extreme weather, especially those who use outhouses in the winter. And then also not worrying about the bucket falling over, or in regards to children falling in or coming in contact with what's in the bucket, which was an issue that was reported previously. It's a more sanitary environment, and especially in terms of air quality, people mention feeling cleaner. And as the quote I read mentioned too, it made a positive social impact for people feeling more comfortable having people over. Some limitations that I wanted to bring up was that this study was done, as I mentioned, during COVID conditions, and the installation of the units took priority over the research itself. So that impacted some of the methods, evaluation, and research activities, because the research activities were secondary. All interviews and data collection were done remotely over the phone, and that is definitely impacted due to location and connectivity issues and just getting in touch with people when they're in their home. And then consistency in data collection, meaning that the households did not all consistently participate in interviews, so it limited the potential for a longitudinal analysis. So we hope these findings will lead to the funding of more installations in rural Alaska. They're kind of waiting for our final report in order to decide if further funding is available. The system was able to withstand weather conditions in remote Alaska and was successful in increasing hand washing and health, and homeowners were overall satisfied. It increased the amount of water hauled and used, but it is not piped water, which almost all households mentioned that they would prefer. So in my eyes, this is a really helpful system to have until piped water becomes available to these communities. This model could be used in other remote unpiped communities, and our next steps as a team is to do in-depth interviews with elders, leaders, and community members to better understand the health and well-being findings from an Indigenous perspective. Okay, and my acknowledgements. First, I want to acknowledge the communities and households that we worked with. They shared personal information with us as we collected data on this sensitive subject matter. I want to thank the CDC Foundation, the Rasmussen Foundation, Silverline, who designed the product, the PASS and mini-PASS teams, which also include the engineering team at my organization, and the Robert Wood Johnson Foundation. Thank you, and I can take any questions.
there. This was really great. Thank you so much for sharing. My question was, did any of the homeowners report using their water for drinking? I know that you mentioned that there was still like water scavenging and collecting that went on, but did the mini pass system, was that used for not only hand washing but drinking water?
Some people did report using it as drinking water as well, yeah. And that might have been that it came from the washitaria, so that would be like a source that's already been treated, and then they just use it as a more convenient way. So yeah, there were some people, but not all. A lot of people did use it for consumption, but the system's still small, it's 20 gallons, so people did seem to limit it more to personal hygiene, hand washing, brushing their teeth, things like that. Yeah. Thank you. Any other questions?
Thank you. Is cost data available for these in both like upfront cost and ongoing maintenance costs, and then who's responsible for that?
Yeah, so this project was funded by the CDC Foundation. The cost of the machine, like the actual system itself, I'm not quite sure, but I think it's in the tens of thousands per system, because or I believe that's the cost of the system itself, and there is a large cost of actually getting the system installed in these rural areas, bringing the supplies to those locations. In terms of maintenance, a lot of people maintain the system themselves or with other people in their communities, but there are people that will travel out and help maintain the system, but I wouldn't know that much about it. It's more of the engineering side of things. We did collect like qualitative data on problems and resolutions, but most people resolved problems themselves or with others in their communities. I think they're really used to having to do that in general.
Hi, I was wondering if you found a sweet spot for capacity, because when I think about the system, I wonder about scaling up for potential use in schools or health clinics or just other places that have more heavy use.
Yeah. Some of the schools and health clinics in particular do have piped water, so those two locations are like exceptions a lot of the time, that they do have like a source for just like more reliable water. But in terms of scaling up, there is actually a full pass system, which I could do a whole other presentation on. And that has like a 100 and 200 gallon tank, I believe. So there are some homes in rural Alaska that have this full pass system, but they're way more expensive. And the reason for the mini pass was to have a system that could be installed really quickly due to the pandemic. So there is that like larger, I actually might have a picture of it here. So this is like the full pass system that has a lot more going on, but a lot more cost and like installation required. So.
Kind of on a different topic, when you did your interviews, were there indigenous water practices that you learned about? I mean, I think humans have been living in Alaska for thousands of years, and presumably they found ways to survive even though in those challenging conditions. So.
Yeah, and actually those are some of the things we're gonna talk more about in our in our in-depth interviews that we're about to do, because we would like to learn more about traditional water sources. Yeah, I mean, people haul water from their traditional sources still, but a lot of those sources, depending on where they are in their community, might not be the same quality as they used to be. So yeah, it was really interesting also to speak to some of the elders and hear how things were where they used to get water and why they can't get it there anymore. It would be things such as like the sewage lagoon. A lot of people have like flooding and erosion, and then just like contaminants or things disperse into the community. Or they just feel like it's not clean anymore. It could be that it's like near where airplanes are parked. It could be many different reasons. But I'm really looking forward to do these next round of interviews to kind of be able to learn more about that. It's a really, good question. Big interest of mine. Thank you all.
Thank you. All right, thanks, everyone. Please feel free to find the presenters if you have follow-up questions, but this will conclude our session. Thanks.